Oop. Hello, everybody. We've got sound. Yeah, sound is working there. All right, great. So, I'm just going to start this evening with a review of Avian sedation, which I really wanted to do on Thursday, but everything else ended up being really long, so we didn't have time to do that. So, this is from the Journal of Avian Medicine and Surgery. This was published in, I want to say, 2021. Yeah, 2021. So, this is a fantastic review article. Once again, really encourage people to join these associations so that you have access to these resources, as well as like the other resources that they have. So this is a review by Grayson Doss and Christoph Mans, who both are really prolific in the veterinary community with research and review articles and education. So one of the, I guess, cruxes that I tried to kind of communicate with regards to avian handling is that sedation is often needed, whether it's just anxiolytics or anxiolytics plus another sedative drug, to kind of potentiate your anxiolytics so that you can have safe handling, because these birds can present in very severe states of illness, and they can already be cardiovascularly compromised, so it's critical to be using drugs that are safe for the cardiovascular system. And we also have birds that can just stress themselves to death. So birds can absolutely have cardiac arrest occur just as a result of stress in the hospital, because they're prey animal species, and we act like predators. We catch them, we do things to them, we manipulate them in weird ways. So it's wonderful if we have patients that have been conditioned to handling and have been conditioned to various procedures like towel restraint or syringe feeding, but that's often not the case, unfortunately. So procedural sedation is really truly necessary for a lot of patients for various procedures, from x-rays to catheter placement, to blood draws. So in this paper, they're talking about, again, stress in our bird species, because stress will kill them, unfortunately. So they're providing a really nice, I guess, review or summary of what these anxiolytics do. So particularly, they're referring to a study where manually restrained cockatiels, if they were given midazolam or a combination of midazolam and butorphanol, they breathed less quickly, so less of a stress response, and struggled less, which is great, because struggling birds mean that, we're not having as good of a grip on them. Potentially they're moving for blood draws, so we can lacerate veins, and birds can actually break bones if we're restraining them really really firmly for x-rays. So this is increasing the safety of our procedures. They're looking at surf scoters, which is a wildlife species. So they're giving a bunch of different examples of how midazolam and midazolam plus an opioid can be really effective at reducing stress responses. So a really nice, I guess, kind of sampling from the literature of how these drugs are effective in various species. So they're going on to review what our indications are. So routinely sedating pet birds to do grooming, like beak trims, and beak trims are not a normal procedure. Healthy birds should generally not require beak trims. Beaks usually overgrow due to some kind of pathology, either nutritional, parasitic, or metabolic. But beak trimming is terrifying. Like, holding a Dremel to a tiny bird's face can absolutely cause a heart attack. Sometimes birds are too stressed out by even physical exams. So birds that are extremely stressed, particularly if we're working with wildlife or aviary birds, can absolutely benefit from procedural sedation. Sample collection, other minor procedures. Oh, excuse me. It's been a long weekend. And of course, diagnostic imaging. So whether that is x-ray or CT or ultrasound, the bird should be sedated. So it kind of just chills them out. It's comparable to, I guess, like a twilight sedation in humans. So you're just kind of relaxed, you're sort of aware of what's going on, but nothing's bothering you, which is great. So, And of course, they're talking about here how it can actually improve the perception of how the bird is treated during the veterinary visit. So if we're not having to kind of struggle to restrain a bird, or a bird is not struggling against our restraint, especially if the client is present, then that just makes the client feel like the bird is, having a better, less stressful visit. So we absolutely appreciate that with dogs and cats when they're coming in on chill protocols like gabapentin or gabapentin trazodone, or other combinations of drugs. Usually we're using gabapentin for cats and gabapentin plus or minus trazodone for dogs. And clients really appreciate that their pet isn't as terrified, or that their pet is not as worried about different procedures or even being examined. So it definitely helps improve client perception. So they're just talking about various... Oh, excuse me. Oh gosh. Various different procedures. Minor surgical procedures, mass removals, tissue biopsies, wound management. A lot of great examples. So moving on to the drugs themselves. Whoops, I have my older dog is in the room and she's just making noise. So benzodiazepines, which they're talking about midazolam and diazepam. Midazolam is absolutely the drug that we use the most with our avian patients. Very commonly used. I've never really used diazepam, outside of a seizure management protocol in a bird. So of course they modulate GABA receptors within the CNS, and again, real focus on anxiolysis, muscle relaxation, and mild sedation. There's a pretty wide safety margin for these drugs. So midazolam particularly, you can use a pretty high dose in a lot of bird species and not really surpass the ceiling effect of more sedation versus or reaching that I guess crossroads of having not more sedation but then having adverse effects. So you can kind of go as high as like 3 mg per kg or even 5 to 6 mg per kg in like some little passerines that have really rapid metabolisms or really fast drug clearance. So, and of course, what's most important here is that they're reversible. So if you are worried about how the patient is doing, or you're done your procedure and you want the animal to recover faster, we can use flumazenol, which we can give via any route. When we have patients who are doing well, we tend to give it intranasally so that it has a nice slow uptake. But you can also give it subcutaneously, which is what I tend to do in small mammals. We can give it intramuscularly, intravenously, intratracheally. It's a very versatile drug. Again, minimal cardiopulmonary effects when we are using it for sedation in birds, which is great because especially if we have patients who are already compromised due to their illness, which is often why they're presenting to us, we really don't want to have cardiovascular or respiratory effects. And of course they're talking about, just storage, like benzos are light sensitive, so keep them away from light, and diazepam is absorbed by plastic, so it shouldn't be stored in syringes. I'm going to skip over this diazepam section because I think most people know what diazepam does. And again, we typically will prefer to use midazolam. So right here, they're going over various drug dosages and what was effective and how quickly they reached effect, which is really neat. So a really great review of various species, and you can see that there are pretty similar doses for most of these species. What I find surprising here is like the 14 plus or minus 1 milligram per kilogram for budgies. That's really surprising. That's a really high dose. So I'm not sure why that dose is so high. I kind of want to look up this paper after number 16. I'm going to make a note of that, and we're going to maybe look at that in another rounds because that's really interesting how high that dose is. Because I routinely use this on budgies. And we're typically using like either 1 milligram per kilogram of midazolam plus 1 mg per kg of butorphanol. Sometimes we'll use 2 mg per kg of midazolam if we have like a really stressed out budgie. So I'm really interested in seeing what these two papers are. So it's 16 for both of them. I'm going to make a note of that for later. And a lot of these birds are sedated with intranasal routes. So intranasal is really effective in birds because it can be really quick. We're just kind of putting the tip of that tuberculin syringe without a needle right against the cere, right against the narrus on the cere, and then kind of squeezing it, doing a couple drops in each nostril. Of course, we do risk the chance of the animal sneezing up the drug, and then we lose some, and then we're like, oh, I'm not sure how much you had, how much can I redose? So that can be annoying. And of course, if there's any respiratory pathology, so if they have like rhinoliths or they have a sinus infection, or they're otherwise having any kind of discharge, I'd probably avoid this route just because you're not sure how reliable that bioavailability or that absorption will be. So so intranasal is great because again, you don't have to jab the bird with a needle, which we do use pretty small gauge needles for most birds to avoid just excess trauma on those big pectoral muscles since they're using them for flight most of the time. Intramuscular can be really can be pretty non-stressful too with confident handlers, but it'll depend on the patient. So they're also talking about here about midazolam butorphanol. Which is which is my cocktail of choice when we're dealing with most birds. And the midazolam ketamine over here, which was used in a ringneck parakeet, Psittacula krameri. And that was used intranasally, which is really neat because I didn't know that ketamine could be used intranasally. I've always used ketamine parenterally. So, here, a canary. So again, those little passerines. So canaries are passerines, they're songbirds. And his is 13 to 16 milligrams per kilogram. That's huge because they have really fast metabolisms. And then this gave a first effect within 1 to 2 minutes, which is pretty common. Oh, that's Ella. She's a good girl. Which is pretty common. We usually see birds start to get dozy within like the first 5 minutes. And then we give them anywhere from like 5 to 15 minutes to kind of relax enough to get procedures done. So this patient was in dorsal recumbency for 38 minutes plus or minus 24 minutes. And then they've got, that's really interesting. That's really cool. This whole study is really cool here. So really neat data. This isn't a species I'm familiar with, Paracorax, a chow, or chaw. I'm not sure what that is. I have to Google that now. Hang on. I'm spelling it wrong. I'm probably still spelling it wrong, but Google will fix it. The red-billed chow. Oh, it's in the crow family, so it's a corvid. That's cool. And it's only one of 2 species in that. Oh, there's a lot happening here. Yeah, corvidae, cool. That's a cool looking bird. I'm sure that was from like either a wildlife study or a zoological collection. I feel like most people don't keep corvids. And then pigeons here. This is like a little over 6 milligrams per kilogram, almost 6.5. Zebra finches, 5. Rock partridges, which are, partridges are gallinaceous birds. Pulling up the ornithology knowledge here. Yeah, they're galliforms. I thought so. Galliforms. So there's a really, really great representation in the literature of how well these drugs work. Here we've got anseriforms. How well these drugs work in various taxa. So, again, this isn't something that like people are just pulling out of the air and saying, well, I'm going to use midazolam on these birds. Like there's a lot of evidence demonstrating its efficacy and its safety. So really, there is no reason why we shouldn't be using procedural sedation more often in birds. And again, like we always have clients that are hesitant because they think, oh, sedation, like drugs are going to kill my bird. And it's really, really uncommon. Usually it's that the bird is just so sick because they got to us way too late because birds are silly and exhibit masking phenomenon. Like it's usually the underlying illness that's killing the bird, not the sedation itself. So And they're talking about the combination here of midazolam, butorphanol, so midazolam and torbigesic, which is, again, like my preferred combination of drugs. They're going over ketamine. So ketamine, I mean, we tend to use ketamine a lot in reptiles and small mammals. We use microdoses of ketamine, so really small doses, to create like a synergistic effect with our other drugs. So it works really well. And also, like, it's really interesting that, like, when I was in school, which is like 20 years ago now, it was drilled into our heads that ketamine does nothing for pain. But now we've determined that ketamine is actually an NMDA agonist. So agonist or antagonist? Hang on. Ketamine, NMDA. Inhibits, blah, 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 blah. I don't think I'm going to find this. Non-competitive channel blocker. Okay. So anyway, it does have some analgesic efficacy, which is really cool because the more drugs we have in our toolkit for pain management and for sedation, the more options we have to treat various patients that have different needs. So I think it's really frustrating when I get asked by colleagues or people who I've worked with or people who I've just talked to about, like, what's your preferred drug protocol for XYZ. And there are just so many variables, like what's the age of the patient? What are their other comorbidities? Are they dehydrated? Do you have blood work? But I think that the midazolam butorphanol combination for birds, although the dose of those two drugs may vary depending on the patient, I feel like that's one of the only protocols where I can say pretty confidently that is safe to use with pretty much all of your avian patients. So they're talking here about alfaxolone, which alfaxolone is a super cool drug. It's a neuroactive steroid. The company that makes alfaxolone, Jurox, which I feel like they were just bought out by another company or sold or whatever. They've done a lot of research on how this drug works in various zoological species. So there's a lot of data. If you get into their here, let's actually look it up here. Jurox. Ooh, can't spell tonight. I'm exhausted. I had my partner's holiday party last night and stayed up much later than usual, so I'm still catching up. Hang on. Okay, so Jurox, and then so their Think Anesthesia part of their website. Yeah, so they have a lot of data and webinars and lots of really great stuff. And I love that there's a leopard gecko here and a guinea pig. It's wonderful. And this looks like a neonate. Yep. So anyway, loads and loads of information on their website. Highly recommend it for any vet professionals to look that up. It's really helpful. So various combinations of alfaxolone, midazolam, using detomidine here, which I don't remember the last time I used detomidine in a patient, where we tend to use dexmedetomidine. I feel like maybe only medetomidine is what I've used and not detomidine, sorry. They're just various like derivatives. So I have used dexmedetomidine intranasally. So it says here not recommended. In the species, I don't remember what species I used it in, but I remember it actually worked really well. We used a combination of dexmedetomidine and midazolam. It was a young, healthy bird that I think had an injury. And they're talking about xylazine ketamine. I haven't used xylazine, honestly, since I was in lab animal science. So, again, various species representations here. There's just so much data, which is great. There is no paucity of data here. So there can be volume concerns when we are using these drugs on really tiny animals. So it can be very challenging. So if you're using a very concentrated drug on a small animal, we typically will use insulin syringes that are 1/3 of a cc barrel so that you have more precision in measuring out units, because if you're using U100 syringes, 1 unit is 1/100th or 0.01 milliliters, or 1/100th of a cc or a milliliter. So that gives you a little bit better precision, just because, again, the gradation on a tuberculin syringe is so small. And if we have very concentrated drugs and we just can't make a dose that makes sense, then we look at doing in-house dilutions with really careful calculations. So I tend to do serial dilutions so that we're just reducing the concentration of the product by a power of 10 or one order of magnitude. And then, doing serial dilutions until we get a drug volume that's really effective. When we're looking at drugs that have really low concentrations, like our flumazenol that we have available is 0.1 milligrams per milliliter. So it often results in really large volumes, which is why we tend to use it intranasally for reversal, because if we're giving that intramuscularly, it can be a really large volume, be really uncomfortable, even if we're splitting it up between a couple of different sites. So yeah, they're talking about avoiding large IM injection volumes. Yeah, that's it. I find that alfaxalone, when I have used it, it just ends up being a pretty big injection volume. And I find that's the case for reptiles too. Like I really hate giving alfaxalone IM in reptiles because there's just not enough sites to kind of split your big volume between, unless you have like your IV catheter already placed. Or sometimes what we'll do with reptiles is we'll do part of it IM or sub-Q. Sub-Q does take a lot longer to absorb in reptiles, especially if you're not able to keep them at their preferred body temperature, which is just not really compatible with treating them. If you're having a hard time keeping them at their preferred body temperature, then their drug absorption and metabolism will be really terrible. So so just talking about intranasal and then reversal agents and our roots. So this is just such a thorough, helpful paper that just goes over everything that you need to put yourself at ease to use injectable sedation or parenteral sedation or just procedural sedation in general in our avian patients. So also really cool, and this is something that there's another paper I want to bring up on another rounds night. But we can see that benzodiazepines, particularly midazolam, can increase food intake. So if you have birds in the hospital that you're trying to get off of support feedings, but they're just so anxious and so worried, give them intranasal midazolam at 1 milligram per kilogram. It can increase their food intake, which is really cool. And it doesn't cause profound sedation at that low dose if you're not combining it with anything else. And then midazolam also has an amnestic effect. So it's something that's been explored in dogs and cats, I believe. I remember we were chatting about adding this to our canine feline protocols for stressed patients to just have like an amnestic effect so that they're less likely to remember quite what went down at the clinic. So that's really cool. So this is such a useful paper. So once again, this was from the Journal of Avian Medicine and Surgery, Dawson Mons from 2021. Excellent review paper.